depends on what the symptoms are for when someone needs surgery on their lumbar spine. Usually we would try to exhaust all of our treatments that are non-surgical first. So activity modification, doing less bending, lifting, twisting. Maybe if there's a lot of strenuous work at someone's job, they'll take some time off of work or do some different responsibilities at work. We'll also try some of those non-prescription pain meds, Tylenol, ibuprofen, and just time. With time, though, however, if things are not going well, and especially if there's some pain going down one of the legs, then that's possibly a concern for maybe needing surgery in the future. But even at that point, then we would probably take it up to the next level and still wouldn't just jump to surgery. We'd probably try some physical therapy first, maybe a steroid injection into the spine to see if that will settle down some of the inflammation that's causing the pain in that nerve root, and then see where we are from there. So there is one exception when we do surgery, and that is when someone has what we call neurologic deficit. So for example, one of the most common nerve roots that get pinched in the lumbar spine affects how we bend back our foot. That's called dorsiflexion. And if we lose that ability to bend back our foot, that's called a foot drop. And most people have probably heard of a foot drop. And in those cases with neurologic deficit, then we say, we probably need to get in there and do some surgery so that neurologic deficit isn't permanent. So that would move things up and be a reason to see your doctor sooner if you're having that type of a problem. So it depends on what's causing it. If it's just a simple disc rupture or disc herniation, or we call them disc protrusion or disc extrusion, then oftentimes we can just drill away a little bit of bone to get to where that disc is pushing on the nerve and then remove that disc fragment, and that's all you need. Usually that surgery takes 30 to 60 minutes, and oftentimes we let patients go home the same day. However, as we age, there's more wear and tear on the spine, and sometimes there's more problems. Sometimes there's a slip of one vertebrae on another. That's called spondylolisthesis, and that may require more extensive surgery. Sometimes there's problems at multiple levels that may require more extensive surgery. And obviously, the more surgery we do, the longer people have to stay in the hospital and the longer it takes to recover. So it really depends on what's causing the problem for what type of surgery people need.